The treatment for ulcerative colitis is complex and may be different for every child. There is no one-size-fits-all treatment for ulcerative colitis, and children respond to therapy differently. Your doctor will evaluate the severity and extent of the disease and decide which therapy is required for your child. The Pukai Score is a way of assessing the severity of the disease. The Pukai Score stands for the Pediatric Ulcerative Colitis Activity Index and is an objective means of determining the severity of the disease. The parameters assessed are abdominal pain, degree of rectal bleeding, stool frequency, consistency of the stool, presence of nocturnal stooling, and the general activity of the child. You can see from this chart that a score is assigned depending on the severity. The higher the score, the more severe the disease. Based on the score, the severity of the disease can be assessed, and your doctor can then plan the most appropriate treatment to control the disease. Treatment for ulcerative colitis involves using a combination of medications, nutritional therapy, and in most severe cases, surgery may be required. The goals of inflammatory bowel disease management are to control symptoms, induce remission, and achieve mucosal healing, while preventing or minimizing complications of the disease as well as medications. We pay particular attention to nutrition, growth, and pubertal development in children, and it is especially important to maintain steroid-free remission in view of the potential side effects of repeated courses of steroids. We need to do this by choosing the appropriate maintenance medication. When treating ulcerative colitis with medications, our goals are to suppress inflammation, heal tissue, and relieve symptoms. This is done in two phases. Induction therapy is used to suppress inflammation quickly. This can be done with antibiotics, 5-aminosalicylates, which are anti-inflammatory medications, or steroids. The maintenance therapy is used to achieve healing and suppress the inflammation and will need to be taken lifelong. The choice of maintenance therapy depends on the severity of the disease, and in moderate to severe diseases may require the use of immunomodulators or biological agents, which suppress the immune function. Attention is also paid to the nutrition of the child, and sometimes there is modifications to the diet or additional of nutritional supplements to provide additional calories in children with weight loss. The choice of medication required depends on the severity and extent of the disease, and the approach to therapy can be either a step-up approach versus a step-down, depending on the severity of the disease and how quickly we need to control the symptoms. This slide shows the commonly used medications. This includes 5-aminosalicylate or the 5-ASA group. This can be given orally or rectally to decrease inflammation in mild to moderate cases. Corticosteroids can be given topically as an enema, orally or intravenously through the veins to quickly decrease inflammation in moderate to severe cases. Antibiotics can be given orally or intravenously to reduce intestinal bacteria and treat infection. Immunomodulators are given orally or by injection, and this is used to weaken the activity of the immune system to decrease the inflammation. Biologic agents are given by an injection or through a vein to stop the inflammatory reaction in moderate to severe cases. Surgery is used to relieve severe ongoing symptoms and to help children achieve growth and weight gain when medical management is optimized and is no longer effective on its own. Unlike in Crohn's disease, in which surgery is a temporary solution, surgery can provide long-term relief with ulcerative colitis.